Good afternoon, everyone. I hope this all finds you well. Today we're going to do things a little bit different. Usually, I'll stand here and talk with everyone and let you know what's going on with the city, with the COVID-19 and the coronavirus and other things that are going on in the city. Today I'm going to actually have someone from McCabe's Ambulance, Mike McCabe, the chief of McCabe's Ambulance, someone who is endeared to the city of Bayonne, his whole family, from his dad, Mickey. McCabe's Ambulance is one of the groups that are in the trenches throughout this coronavirus, and I think the people of Bayonne need to hear from someone other than me. But before that, let's just keep doing our social distancing. We have hit the plateau. We have gotten it to the point where we have flattened out the curve. But we need to keep going. We need to keep doing what we're doing. We need to keep the social distancing going. We need to protect those who are vulnerable. And that's why we have to continue going and continue staying strong. But today, what I'm going to talk about is for Saturday, April 25th. This Saturday, we're going to do Earth Day. Earth Day in Bayonne this year is going to be a lot different. And what I want everybody to do is I want everybody to come out of your house, get some fresh air, bring a broom, bring a shovel, sweep up the front of your house, sweep your sidewalk, sweep your curb line, clean it up, put it in the garbage. Take your garbage bag, put it with your regular garbage. We will pick it up when you put your garbage out. This is what we need to do for our city. This is our city. This is where we live. This is where we shop. This is where we go out to eat. And I know we can't go out to eat right now, but this is what we need to do to make our city look that much better, because it's ours. It's where we live. And I want everyone to try and participate, if you can, participate on Saturday by just cleaning up the front of your house. It's a simple, simple task for each one of us to do. Just go outside, sweep your sidewalk, sweep your curb line. If you have neighbors who are elderly or who are vulnerable because of COVID-19, I want you to do theirs too. And the biggest thing I want you to do is take pictures, take video of you and your family doing that, of your children doing that. Send them to me, because we're going to make a collage out of this. And we're going to show the rest of the state and the rest of the country what it's like to be a real community and a community that sticks together. So with that being said, I'm going to bring in Mike McCabe now from McCabe's Ambulance, a dear friend of mine, a dear friend of everybody in the city of Bayonne, because we all love McCabe's Ambulance. And this is someone who is in the trenches and knows what's going on firsthand with COVID-19. So ladies and gentlemen, Mike McCabe.
Thank you, Mayor Davis, for having me, and good afternoon, Bayonne. At the outset, I want to start by thanking the citizens of Bayonne for the incredible love and support that they have shown to the men and women of McCabe Ambulance over the last 6 weeks. The daily donations of food, masks, gowns, and just the well wishes shown to us via social media has been overwhelming and moving. These acts of kindness are what make Bayonne such a special place. All I can say is thank you from the bottom of my heart. I want to take a moment to personally thank my staff for their Herculean efforts throughout this crisis. I am not embellishing when I say that I have never been prouder of a group of professionals than I have been of these EMTs, paramedics, and nurses. The word hero is often thrown around very loosely, and those that run calls in EMS day in and day out often do so out of the public eye and with very little fanfare. These people are heroes. They have given of themselves to the community with no regard for the well-being of themselves or that of their families that they go home to. Since the beginning, I have been labeling them as frontline warriors. They have earned every right to carry this title. Thank you for your service. Bayonne is incredibly lucky to have you. As we move into our 7th week of what feels like an eternity, there are some promising signs to be optimistic about. The number of COVID-19 related responses is decreasing. 4 weeks ago, the surge we were experiencing was something like we had never seen. It was difficult keeping up with the demand. Our units were running nonstop, 24 hours a day, and the call volume transitioned to predominantly all COVID cases. Our hospital was overwhelmed. Additional treatment areas were established, and the staff at Bayonne Medical Center bravely continued to fight this invisible enemy, creating ICU space in every corner of the hospital. more acts of heroism. As a frame of reference, in the first week of April, we consistently responded to 20 to 30 calls for service a day for COVID-related illness. This week, we are seeing a daily number in the range of 5 to 8. Yes, this is very encouraging, but we must refrain from celebrating just yet. Despite there being far less calls for service, the virus is still very much active. The decrease that we are seeing is directly related to the measures put in place at the state level and here in Bayonne under the direction of Mayor Davis. The community is doing a fantastic job flattening the curve, and we must continue to exercise these distancing protocols, or we run the risk of seeing another surge that frankly could be worse than the initial. I want to be clear. Our 911 system here in Bayonne is fully operational. We are prepared to respond to any medical emergency, COVID-19 related or not. Our emergency medical dispatchers are working tirelessly to ensure the safety of our citizens, as well as our EMTs and first responders. Should you call 911, there are a few things that you should be aware of. First, our call takers will be extremely specific with their questions. They will be direct about any COVID-19 symptoms being present or any history of COVID-19 in the household. These questions are asked for the protection of our responding EMS professionals as well as our police and fire counterparts. Additionally, we are instructing callers to meet us at the door if they can manage. Once again, this is being done to avoid any unnecessary exposure. Obviously, the patients that cannot physically walk to the door will not be expected to. If you are calling due to COVID-19 symptoms, once arriving units get to your house, our EMTs will put on their full PPE outside of your residence. This may cause a slight delay in entry, but again, is necessary to avoid exposure or contaminate the responders. You should know that we are working tirelessly to ensure that there is no cross-contamination of non-COVID patients who may need to utilize EMS. Our ambulances are electrostatically sprayed with an antiviral solution after every call that we encounter a positive or presumed positive COVID patient. The safety of our responders, as well as our patients and citizens, have always been and always will be the priority. There is a light at the end of the tunnel. We must remain vigilant, disciplined, optimistic, and grateful. During the worst times, Bayonne always rises to the challenge. We are stronger today than we were before this, and we learned that the power of our community and the public servants that work here will always outlast any difficult time. Thank you, Bayonne, for all that you have done to support us. Stay healthy, and we will all celebrate together soon.